A 24-year-old man from the Malawi present with lymph adenopathy and weight loss. A diagnosis of tuberculosis is suspected. So this point is very, very important. Here diagnosis is almost confirmed that it is suspected case of the tuberculosis. And lymph node biopsy performed. The staining with which of the agent below is most likely to facilitate the identification of the causative organism. That means in case of the tuberculosis, the organism is the Mycobacterium tuberculosis. So in case of the Mycobacterium tuberculosis, which type of the staining we usually do? So it is direct question that in case of tuberculosis, which type of the staining we usually use. And the lymph adenopathy and weight loss, they are the clinical feature of the tuberculosis. So here the options are Gram stain, Jill Nelson stain, von Kosha stain, von Gation stain, and Mason trichrome stain. So what may be the option? In case of tuberculosis, all the information are equally important, all the lines are very, very important. So take care, special attention with this point regarding the tuberculosis. First of all, it is primary chronic inflammation. So this point is very, very important. It is the primary inflammation and it is the chronic inflammation. So primary chronic inflammation is the caused by the Mycobacterium tuberculosis. Then second one, it is caused by the inability of macrophage to kill the Mycobacterium tuberculosis. The Mycobacterium tuberculosis is a strong organism. Actually, the covering of the Mycobacterium is very, very strong. For this condition, macrophage cannot kill this Mycobacterium tuberculosis. And what macrophage do? This macrophage, it present the Mycobacterium tuberculosis to help a T cell in the regional lymph node. So it takes the Mycobacterium tuberculosis to the regional lymph node. And the lung lesion, when this condition, that means when there is lung infection together with lymph node involvement, in this condition it is known as the Ghon complex, and it leads to formation of the granuloma, which is collection of the epithelioid histiocytes. And there is the presence of caseous necrosis in the center. This point also very, very important, that in case of the tuberculosis, which type of the necrosis develop, it is usually the caseous necrosis. And another important point, which type of the hypersensitivity reaction in case of the tuberculosis, it is the type 4 or delayed type of hypersensitivity reaction developed in case of the tuberculosis. And immunocompromise, in case of immunocompromised patient, that means people when there is reduced immunity, in this condition miliary tuberculosis develop. And what is the diagnosis? The waxy membrane present, which is the mycolic acid, it prevents binding with a normal stain. So normal stain is not possible to staining of the tuberculosis. So in this condition, Jill Nelson staining. So it is the another important point, that Jill Nelson staining is the staining procedure for Mycobacterium tuberculosis. And what culture based is another option, but it requires more time, and it is the longer duration. For this condition, we cannot wait for the culture. And these 2 points, one is the Ghon focus, another one is Ghon complex. So what is Ghon focus? When the primary infection occurs in the lungs. And what it is complex? When it also involves the lymph node. So when the primary infection present in the lung with the nodal involvement, it is the Ghon complex. And when only present in the lung parenchyma, then it is known as the Ghon focus. So what is the staining? It is direct question. It is the Jill Nelson staining. So for diagnosis of the tuberculosis, which type of the staining is required? It requires the Jill Nelson staining.